this video, I'm going to be assessing the eyes. I have a Snellen chart, which is the chart that you use to test visual acuity. You place it 20 feet from the patient, and the top number is the distance from the chart. The bottom number is the number that most people can read from that distance. So you take the Snellen chart, place it 20 feet from the patient, you test their vision acuity with their glasses on, with their glasses off, and document that finding. You also take the Rosenbaum reading chart to check their vision acuity for reading. Place it approximately 14 inches away from their face to let them test their vision acuity for that, for their near vision. Also, what you can do is you're going to do the confrontational test, which is where you get hold this over your right eye, and then I'll hold this over my left eye, and then you check the peripheral vision. Whenever you can see my fingers, tell me.
I can see them.
Okay.
I can still see them. I can still see them.
Okay. Then the other side.
I can see them. I can see them. I can see them.
Okay. Confrontational. You get face to face with them and do that. You'll check the corneal light reflex test. You take your pen light and you you'll dim the lights, remove their glasses, and you'll need dim lights for this. You check the corneal responses to the lights. Okay. Then you also, at this point, will check. Go ahead and put your glasses back on. Called the cover test. You cover one of their eyes, and whenever you remove the paper, the card from in front of their face, in front of their eye, you notice if there's any movement, any problems with their eyes. It should be steady, shouldn't move any. The diagnostic positions test is where you have them look straight right here, and then they look up, follow the movement of their eyes in the 6 positions. Okay. Then look right here, and then look at the wall behind me. Okay. Look back. Look at the wall behind me. Okay. Wall behind me. And the wall behind me. Okay. And then just the general assessment of their eye structures. You're going to look at their eyebrows and notice, of course, for symmetry of everything. You're going to look at their eyelids and their eyelashes. The eyebrows, you're going to notice the hair, if it's coarse, fine, how it's distributed, thin. You're going to check for any puffiness, edema around the eyes, and of course any lesions or sores. Palpate around, checking for any problems there. The eyelids and the eyelashes, you'll palpate. Close your eyes for me. Palpate on the eyelids for any lesions or sores on them. The eyeballs should be firm, but not hard when you palpate over them. You're going to check your conjunctiva. Pull their eyelid down and check it should be red and moist. No lesions or sores. Check on both sides. Then you can check the top conjunctiva too by putting the opposite end of a sterile Q-tip on the eye lid and holding the eyelashes and pulling it up to check the conjunctiva. We're not going to do that for this demonstration. You're going to check the sclera. It should be clear, and the lacrimal, you're going to check the tear ducts by just mashing on them. Checking, palpate, check for any problems with that. Again, it should be moist in there. No lesions, no problems with that. Then you're going to get your corneal lens, and you're going to start with it on 0 and start 30 centimeters away. Notice the size and shape of the pupils, the pupillary light reflexes, the accommodation. Do it on both eyes. And while you're there, you're going to be looking for the retinal vessels, the color, the artery and vein ratios, the arteries and veins where they cross. There should not be any nicks or tears, any problems with that. You're going to look at the fundus at time of the blood vessels. If you're having trouble finding it, trace the blood vessels back to the fundus, and as you get closer, you're going to adjust on the retina with the light. You're going to note the size, the shape, the margin, the cup disc ratio, and there can be like little freckles, little lesions in there on the retina. You want to note those, and you measure it by the size of the retinal, how many, that's how you measure with it. The general background of the patient's eyes, any problems, any history of problems, any lesions, any colors, the integrities, and then of course the macula, if there's a history of macular degeneration, any problems with the eyes, just check for all of that. Any questions?